Afternoon, everyone. I'm Randy Yunus from Michigan State University. I'll be the moderator for this session, which is this accessibility review, and then how to do that. And it's going to be presented by Catherine Green, Associate Director for Resources and Copyright Support from Georgetown University Medical Center. Catherine? Oh, excuse me. One logistics. The chat is open for everyone, but if you have questions specific for the presentation, please use the Q&A box. Thank you. Go ahead, Catherine.
Thank you so much. I appreciate the introduction. As was said, my name is Catherine, and I am the Associate Director for Resources and Copyright Support at Dahlgren Memorial Library, the Health Sciences Library for the Georgetown University Medical Center. So today I'd like to outline how to create an accessibility review at your own institution or library. For a little bit of background on Dahlgren Memorial Library, or DML as I'll call it, we support various patron populations, such as a School of Medicine, a School of Nursing, a School of Health, biomedical graduate and education and research programs, a hospital, and a cancer center. The library boasts a robust resources collection that is about 99% electronic. Resources include almost 16,000 journals, about 160 databases, over 20 point-of-care tools, 17 medical apps, and over 6,000 electronic or e-books. For those not terribly familiar with accessibility, in 2022, the CDC created the Behavioral Health Risk Factor Surveillance System, or the BRFSS. It revealed that more than 1 in 4, over 70 million adults in the United States reported having a disability. So, and that's not including children. This is a self-report, and it's not even global. So just to kind of give you some perspective, the first step in learning about accessibility isn't so much the standards as it is keeping people with disabilities in mind. The individuals who interact with the content at your library aren't disabled until they interact with poorly created content. The individual is thereby disabled by that content. This is the social model of disability. So, according to the website Accessibility Initiative, or WAI, pronounced WAY, its goal is to provide standards for web content accessibility, meeting the needs of individuals, organizations, and governments internationally. Therefore, Web Content Accessibility Guidelines, or WCAG, current version is 2.2. So these guidelines are broken down into 4 principles. They call them POUR principles. The first is perceivable, which just means having text equivalents for content like images or audio files. operable, meaning that it's navigable from a variety of different tools. Users should be able to read and use the content at their own pace with the tool of their choice. Understandable, ensuring that multiple languages are considered, including navigation mechanisms that can be found throughout a page. And robust, operated by a variety of different tools and methods. Each principle is broken down even further with accessibility requirements that must be met with different levels of success, with A being good, AA being better, and AAA being best. For example, there is a quick reference online on how to meet the WCAG standards. So for example, we have guideline 1.1. It discusses text alternatives and it falls under the perceivable principle. And 1.3 would be adaptable. So that means you would want to create content that can be presented in different ways. For example, a simpler layout without losing information or structure. 2.4.5 is called multiple ways, and that falls under the operable principle, that there's more than one way available to locate a web page within a set of web pages, except where the web page is a result or a step in a process. Guideline 3.1 is called readable, and that falls under the understandable principle. That just means making text content readable and understandable, which means no jargon, no complex sentences, or abstract ideas that can't be broken down. And then guideline 4.1, compatible, which falls under the robust principle. And that just means you would want to maximize compatibility with current and future user agents, including assistive technology. The type of institution will determine which level of success you must meet. While the federal government success requires success levels be at AAA, many academic institutions only require success at A or AA levels. DML specifically follows the guidance and direction of Georgetown University's accessibility group. This group provides accessibility guidelines and guidance for digital content created at the university, as well as digital materials contracted for use by the university community. They require A and AA success with manual and automated testing at the initial launch, and then continued vigilance moving forward. My focus today is on setting up annual departmental accessibility review systems for existing platforms, such as library catalogs or research guides. In 2018 or 2019, I can't quite remember when, there was a greater emphasis put on accessibility by the University Information Systems, or UIS, department. DML broke down accessibility needs into website accessibility and resources accessibility, with one member focusing on Springshare LibGuides and the other working on the accessibility of the website. As the resources and copyright support librarian, I focused on the SpringShare LibGuides, which brings me to how we did broader accessibility reviews for DML core user platforms and how you might want to set up reviews at your own institutions. If you are looking for resources on planning and managing accessibility, the W3C Way has a planning and managing website. It discusses how to plan, initiate, plan, implement, and sustain website accessibility. Before the reviews take place, the first couple of tasks that we did were to determine staffing for the project and scheduling the reviews themselves. Excuse me. As I had worked before and was continuing to work with LibGuides, other resource accessibility responsibilities were shifted to me. According to the Planning and Management website, it is important that the person have a bit of background and interests as well as access to the basics of accessibility prior to implementing, which I had. While DML only has a 6-week period between when the first-year medical students finish their term and incoming students arrive, DML does a lot of bigger projects like physical book reading and other resource changes, so we figured that was the best timeline for us during the summer. Other institutional timelines are going to be based off of what part of the accessibility journey they may be in. Perhaps they're trying to create accessibility policies, or they want to do what we did, which was address nonconformance. DML tried to complete the actual accessibility work itself within the fall semester timeline. Once the schedule is in place and you have the appropriate staff to do the reviews, it is important to determine which key platforms to include. DML included the following: a Discover tool, a journal finder, a citation matcher, a library catalog, our chat platform, an FAQ page, library forms, the interlibrary loan platform that we use, and room reservation systems. So after determining the platforms, the work of doing the review begins. It is important to check with the institution to determine whether a program is in place for projects such as this. By using what has already been purchased for the university, there won't be a need for extra spending. Having the support of the university is vital for this kind of project. DML had the support from senior leadership in the library as well. The necessity of library awareness is key. According to the planning document for the W3C, General Introduction to Accessibility benefits everyone in the organization. As this had begun with an urgent push from the UIS department, awareness was already present at DML. For DML, UIS had already selected a checker for the university to utilize called SiteImprove. SiteImprove is an accessibility checker that does website checks on its website interface and and also a browser extension. Once added to the preferred browser, the extension works to check the status of any web page you choose. At first, we didn't know there was a browser extension, so we just had the website analysis for LibGuides as a whole. But now that we know that they have a website, a web page extension, that's what really helped us with this process. Here's an example of what Site Improve looks like. Here we have an example of our catalog. And on the left here, we have the actual checker, the what it has checked and brought up as results for us. You're able to select filters. For example, we would be using A and AA. We would not be looking at AAA as much, nor would we be looking as much. Whoops, sorry about that. As much with the ARIA or best just suggestions that Site Improve would kind of pop up with. So you're able to sort of filter through that. In this case, it tells you what type of issue it is, whether it's perceivable, whether it's operable, whether it's understandable, or whether it's robust. Provides you with the number of occurrences and where those live. If you click on the link itself, it'll tell you more about the occurrences. It'll highlight where on the page they're living and any solutions, suggestions, things like that. Other accessibility checkers available besides Site Improve include Web Accessibility Evaluation Tool, or WAVE, which is free, Axe, DevTools, Pally, Accessiby, Tnon, and many others. There also needs to be a plan in place to track the issues that have been spotted by the checker. DML used Excel for reporting, but you can use other tools like Google Sheets, Google Docs, or other products as preferred. Make sure that the tools that you use to track are standard. This allows for comparisons between web pages and websites. We also, while we did develop specific measurable criteria pass and their level, other examples of reporting results could be complaints due to accessibility or inaccessibility of resources, and then the number of training sessions on accessibility delivered to the staff. This might be a little small. I apologize. See if I can make this. Anywho, I was going to see if I can make it bigger, but I don't want to waste everyone's time with that. So here we have the Excel spreadsheet that we used for reporting. In this case, this is from 2023, and this is an accessibility review of our DML citation matcher. So in order to kind of let key stakeholders know the page that we were working with, the URL that we were evaluating. We put tabs here at the bottom. In this case, we have the Citation Matcher Journals results page, and we have the URL for that, so we could go back and revisit at a later date, as you know, to compare and see how things have progressed or not. It kind of goes over how many issues there were, the severity, the type, the number of occurrences, where they occurred, and then example solutions provided either by myself or by SiteImprove itself. For the different platforms and the reports, identify which staff member needs to be made aware. Knowing the stakeholders for each platform is important, so the individual who ran the report doesn't necessarily need to correct the issue or communicate the issues to the vendor. Once the reports were finished, meetings were set up by the Senior Dean of Knowledge Management and the Associate Director of Resources and Copyright Support, me, as well as other members of the resources and access teams. The meetings occurred in early fall and helped the other staff have an opportunity to ask questions and determine how to contact the vendor or fix the issue in-house. Once the reports were finished, some common, easily fixable issues that arose were things like size of words or color contrast problems that I or the responsible staff member could fix with trial, error, and lots of CSS. These were items that needed to be prioritized as well because they were high impact. Here we have an example of how we addressed common issues. So here we have the 2024 Document Delivery Accessibility Review. For one of our pages, we had a number of issues pop up for our buttons that were not big enough. It needed to be 24 by 24 pixels, and the size of the element was usually smaller than that. And this is really assistive to kind of be aware of that for those with mobility issues or maybe hand tremors. That's too small of a space to have at your disposal to click on something. You need to be able to have a wider area for those individuals to click. So in this case, this is what the issue was itself, that the interactive element does not meet minimum size nor spacing, and it discussed why this was an issue. And also it would provide success options, not options, but suggestions as well. And then here on the left, we have these links are much bigger now because of the work that we did on the review. And that met the success criteria that we were looking for. Other not so easy to fix issues would be items that need to be addressed by the vendor. Some examples would be like backend HTML that we didn't develop, such as link purpose or ARIA labels. For those who may not be quite familiar, according to the WCAG 2.2, link purpose in context. The purpose of each link must be clear from the link alone or from the link text and its surrounding context. ARIA labels stand for Accessible Rich Internet Applications. These specifications provide an informative description of each role, how it relates to other roles, and the states and properties for each role. The staff person in charge would then contact the platform vendor with this spreadsheet in front of us to kind of highlight where these issues were occurring. And then they would report back whether the vendor was able to fix or not fix the particular issue. In this case, they were not able to fix it, but I would assume 2 years later, we'd be able to get good progress on this type of issue so that from the get-go, they're able to kind of bake accessibility into their workflows. The staff person in charge of that particular platform, as I mentioned, would report to the vendor. And then when DML first did the stakeholder meeting, there were a lot of questions regarding the process because it wasn't terribly clear how we were going to provide these to the vendors. But once a clear process was laid out, it was much easier to move forward. So after our second year doing reviews, DML created policies and procedures based off of the vendor or platform. Due to now having 2 years worth of reviews, as well as policies and procedures, the organization was definitely needed. The library already had a place for policies and procedures, so the newly created procedures went into that folder. The reviews themselves were placed into a new folder called Accessibility Reviews. The library folders are all stored in Box for security purposes. As we move closer to the summer months again, DML has started to continue to create and complete these accessibility reviews. The policies and procedures may need to be updated and addressed if anything is unclear, if the standards change, or there's a change in the content itself, which may introduce accessibility issues. For the future, I have been asked to consider a step-by-step video on how to fix certain CSS type issues. This would include a step-by-step view of an inspect tool like Google Chrome, which allows the user to see the CSS and HTML pathways being used in different parts of a web page. Another goal for the future would be to potentially provide a training session on accessibility, as well as other continued skill training for key stakeholder staff. Also, TML has monthly all librarians meetings. In these meetings, individuals discuss updates for the good of the group. I may take 10 to 15 minutes to go over any accessibility problems affecting librarian content that they create on platforms like LibGuides if there are multiple accessibility issues or the same issue over and over and over again. So thank you very much. I'd love to open it up for questions or comments. Thank you for your attention. I really appreciate it.
Thank you, Catherine. This is excellent topic to discuss. If anyone has a questions, feel free to use the Q&A box, or if you prefer to speak, you can raise your hand and we can unmute you. I do have a questions, Catherine. For the platforms that are not typically, that's actually use something like Live Guide for some example. When you do the review and you record that, and then do you send back your report back to the SpringShare company or other vendors or something like that? And then how do they respond to it?
Right. No, that's a great question. For like SpringShare, for example, I'm able to do a little bit of back-end CSS work, thankfully, because I have admin rights. So I'm able to do, if there's something that's on the back end overarching that's not librarian specific, I can fix that. If I'm not able to, the tech support at SpringShare is so responsive in terms of if we were to give them something like what I showed, they would be able to come back and say, we are in the process of making this more accessible. Thank you very much for letting us know. Other vendors, they're smaller, so it's harder for them to kind of bake in accessibility from the get-go, and it's harder for them to fix it than later in the process as well. But we do send them our reports to state that, these are issues that we are encountering, and that, it's accessibility is the law. And not that you necessarily say that, but you do let them know how important accessibility really is for your organization and whatnot. And that, I think the last time we sent them a report, I think they were, I don't think they were able to address it, but since it's been a year,
Mhm.
those issues plus other issues have begun to creep up. So I think, and having a year under their belt to work on accessibility issues from their end, I think we'd be able to work something out this time with them to actually work with their technical support team and whatnot to try and tackle these issues.
Okay. We have questions. Do you request accessibility conformance reports from the vendors?
We do for as many of the vendors as we can. And then, or at least they tell us, that's something that we're working through. We're working on getting our materials, our resources more accessible, because perhaps it wasn't something they thought of in the beginning, but now they're sort of taking steps back to kind of address those issues. But yeah, we have an electronic resource management software that we use, and we do try and get those. Usually they come in the form of like VPATs. So we try and get the VPATs from the vendors. And in negotiations, we usually try and bring up, oh, what is your policy on accessibility and things like that. So it's definitely an important part of our procurement and continued work with our vendors.
Thank you. Another questions. When reviewing or negotiating possible new resources, if a vendor does not meet WCAG standards, is that a deal breaker for you?
That's a great question. I think we've been able to get at least confirmation that they're working on it. So that's good, but that's while I'm not a part of the negotiation process per se in my library in the library that I'm working, but I know that accessibility is kind of one of those hot topics that we do try and encourage those in those positions to sort of ask about and follow up with them about, because it is so important. Um, I think it would depend on the resource in terms of whether they're willing to renegotiate, whether they're willing. I mean, we have to be willing to walk away if it's a really popular resource. That would be very complicated, and I think it would be we would be uh, it would be very difficult. I think we would try very, very hard to work with that vendor to consider accessibility. And if it wasn't a if there's an alternative available, I think we would consider that alternative instead of pursuing um, a license agreement with a vendor unwilling unwilling to at least explore this important um, topic.
Anyone else has questions for Catherine? So in the meantime, for a vendor whose resources are very important but could not provide an thorough accessibility for their product, do you remediate it yourself?
We do. We have another coworker of mine and I have, through kind of trial by fire, become savvy enough with some CSS work that we can kind of do a little bit to at least accommodate what we can. It's more difficult when we don't have the ability to go back in a back end like admin style. I know that, for example, for our interlibrary loan or document delivery platform, it's a smaller organization. I don't know if they were able to necessarily provide us with any solution, but we were able to go back even I think we were able to go back on the back end and tinker with the sizes so it worked, so it would meet accessibility standards for us.
Thank you.
You're welcome.
Any other questions from the attendees?
One resource that really assisted me with this project, also including a couple of years of being able to kind of work through the kinks, was that there was the W3C school, the W3 schools for HTML and CSS were really assistive to me, kind of just getting CSS support and kind of working through what do I want to get out of this and how do I make that happen. But also the WAI, the website accessibility initiative itself, they have, through edX, they have a course that you can take that is free if you don't want to do the end result certificate. It's for free, and it does allow you the opportunity to kind of see like real examples of real people and their needs and how we can make this successful, just as successful for others as it is, make it as successful for them as it is for anybody else. Something that was mentioned a lot in that course was required for some, useful for all in terms of accessibility. And it's being synonymous with user interface or user experience. So it's that was a really helpful course for me.
All right. Let's wait for a few more moments for if any other questions coming from the audience. If not, and I think this will conclude the presentation from Catherine. Thank you very much, everyone, for attending. And I hope you have a good time. We're going to be, there's a break after this, and the next session is going to be at 1:30. Take care, everyone. Thank you, Catherine, very much.
Oh, thank you very much for having me. And if you have any questions, you can always email me at kg615@georgetown.edu. Thank you very much.
Thank you. Take care, y'all.